Hello, beautiful people, and welcome to Making It on Mondays. My name is Louise Jeffrey. I'm an acupuncturist and a practitioner of Chinese medicine. I'm also a mindset coach, and I am going to be talking about IVF do's and don'ts, so things to avoid or include during your IVF cycle. So I'm going to talk for about 10 minutes today, 10 to 15 minutes, and please feel free, if you're on this recording, to let me know, excuse me, if you have any questions along the way, or if there's anything you'd like to comment on, if anything resonates with you, just let me know by typing it into the comments box below. Excuse my voice today. All right. So as I said, today we're talking about IVF do's and don'ts. But before we start, let's briefly touch on what ideally we should or shouldn't be doing before we even go into an IVF cycle. Now, this is in an ideal world because for some of you, you may already be in an IVF cycle, or you may have already been trying to conceive naturally for a period of time. But there are a few things that we would like you to obviously start on before we even go into an IVF cycle. And I've talked about that, or about these, on quite a few of my previous lives. One of them is to prioritize your health, so to focus on your own health and getting your own health really in order. Number 2 is to manage our stress levels, right? Using things like yoga, meditation, therapy, or acupuncture, because IVF is such a stressful time, right? In fact, trying to conceive is such a stressful time. It really is a very difficult journey to be on. And we always say if we can't change our circumstance, we need to change our body's response to that circumstance, to that stress, right? So what we're trying to do here is to manage our stress levels, to stop our body from going into the stress response. Yeah. So prioritizing our health, managing our stress levels, getting enough sleep, right? So making sure that we're getting 8 hours of quality sleep per night. And then also making sure that we're taking our prenatal vitamins and supplements that we may have been prescribed, and also herbs if they've been prescribed to us. Obviously, this is prior to an IVF cycle. All right, and then also making sure that we're eating well. So all of these things are really important for us to start doing prior to IVF cycle. But if you haven't focused on those prior, then even starting now is going to help you. All right, so we're going to talk specifically today about do's and don'ts during an IVF cycle. But before we start, I just wanted to share something with you. I wanted to share a thought with you. Every day, embryos around the world survive in the uteruses of women who are working in fields, tending to crops, working at checkout counters, enjoying business lunches with wine, yeah, or as our brochure says, jumping on and off bicycles. But your embryo is slightly different, right? Because you've put such a lot of effort into getting it this far. So for me, I believe that it's probably worthwhile, excuse me, treating yourself a little bit more gently for the few weeks during your IVF cycle. And that's what we're going to talk about today, right? So let's start with exercise. The question that we always get asked is, can I exercise during IVF, right? And what is safe and what is not? Well, the good news is exercise is almost always a good thing. We know this, right? Not only does it improve our overall health, but it also does a lot for our mental well-being too. Now, movements such as walking and lightweight exercises are all safe during an IVF cycle. And yoga is also great, right? But one form of exercise that we tell all of our patients to try and stay away from during IVF stimulation is things like CrossFit or HIIT, right? Which is high intensity interval training. And the reason for this is because your ovaries are growing when you're in a stim cycle. They're growing and they're becoming larger. And when that happens, exercise can really increase your risk of ovarian torsion, right? Which is when the ovary twists on itself, causing pain. And so, your body's having to do a lot of work in the first part of your IVF cycle. So from a Chinese medicine perspective, we want to preserve your qi as well, right? We want to make sure that you're super strong, right? That you've got a lot of qi to go into receiving this embryo or producing the eggs, and then receiving this embryo and having implantation happen. So what we don't want is for your qi to be depleted. So we don't want for you to be exhausted from exercise, right? And in the second part of your cycle, it's really a good idea to avoid too much stretching, right? And avoid yoga inversions or yoga pelvic twists, right? And it's the same when you're pregnant. So we also say, not to do heavy weights or anything really that compresses the abdomen or the lower back as well. All right. So very gentle exercise, in your the first part of your stim cycle, but particularly in your 2-week wait is okay. All right. So walking, but not too vigorous walking is fine because we don't want to get your heart rate up too high. And generally we want to make sure that you just don't overheat, right? Because overheating is not good, for the embryo. So the other thing that we say in Chinese medicine as well is to avoid swimming in cold water because we don't want you to get your uterus cold. We want to keep your uterus warm so that the blood flows smoothly. And that's also why in Chinese medicine, we suggest that you avoid icy drinks or chill the food, when you're trying to conceive. All right. Next question. A lot of patients ask about diet during IVF. And sometimes they ask, do I have to completely stop eating sugar or drinking alcohol, coffee during an IVF cycle? And what we suggest is that if you start to make healthy choices now, these are going to follow you through your pregnancy and beyond, right? So we always suggest that even in the lead up to IVF or as you're starting to try to conceive, that you're eating mainly a whole food diet, right? With very few processed foods. Now, if you listen to any of my other lives on fertility nutrition, we suggest starting to eat whole foods in the lead up to trying to conceive. But we also suggest trying to eat organic or pesticide free, right? And the reason for that is because there's harsh chemicals and pesticides in these foods or, that have been put onto the foods that can really interfere with our reproductive hormones. However, having said that, during an IVF cycle, the key word is really moderation, right? Because if we're too strict and we're too restrictive, that can also have an impact on how relaxed our energy is. So if you want to have some dessert or a slice of pizza, if you really feel like it, then have it, right? I always work on the 80-20 rule. And what I say is that if you're eating well 80% of the time, then your body will be able to cope with the 20%. But if you want to go pretty much for the 90 or 95% during IVF, then go ahead and do that, right? For that shorter period of time. All right. Then moving on to coffee and alcohol. The thing is actually no hard and fast rule here when it comes to coffee and alcohol. But what we do know is that studies show that even moderate amounts of coffee and alcohol can negatively affect IVF outcomes, right? So we generally suggest avoiding both coffee and alcohol during an IVF cycle. And the reason is because they put extra strain on our liver, right? Now, the liver is working really hard during a stim cycle, particularly during a stim cycle, to detoxify the blood, right, from all the stim meds. And so we don't want to add to the load. Now, particularly after embryo transfer, we really pretty much consider you to be pregnant after your embryo transfer in that 2-week wait. So we really say that alcohol should definitely be avoided in that 2-week wait. Now, if you really struggle with giving up your coffee, then 1 to 2 weak coffees during the course of that IVF cycle is probably going to be fine. But if you can give it up, then we suggest that you do. All right, next question. Can I travel during IVF? Well, the answer to this question is really that it's best to work with your clinic, right? Your fertility nurse is the best person to talk to when you're planning out your IVF schedule, right? And most of the time, like a short weekend getaway is okay. I mean, generally it can be managed during an IVF cycle. And that's really if you don't need to go in for bloods or scans at that time, right? But you're probably not going to know until closer to the time. But longer trips are really likely to be pretty impractical because of the fact that you've got to go in for bloods and scans. Now, when it comes to flying, a lot of people ask us about, can I fly during an IVF cycle? I've got to fly up to Brisbane for the day, or I've got to go somewhere for a night. There's no research to support that flying is dangerous during an IVF cycle. So if you can fit it in with your IVF cycle, then we would say you can actually go ahead. All right, next question that we get asked is, can I color my hair and can I get my nails done during an IVF cycle? Well, what we suggest is that avoiding fumes and perfumed skin products, in particular in the 2-week wait, in other words, after your embryo transfer, is really a good thing to do. And this is mainly because what we do know is that embryos are particularly sensitive to volatile fumes. And most IVF clinics are going to tell you to avoid perfumes and strong smells on the day of your embryo transfer and up until your pregnancy test, right? But we also suggest avoiding things like painting your house or renovating your house during an IVF cycle. And for the same reason, try to stay away from the petrol pump, right? And inhaling petrol pump fumes or getting them on your skin. All right. And then another thing to avoid during an IVF cycle is hot baths or hot tubs and saunas. And the reason is that we don't want your body temperature to go up too high because there's a possibility it may impact, the very, very delicate embryo. But this applies to you during pregnancy as well. In pregnancy, we ask that, we suggest, recommend that you don't have baths that are too hot. Lukewarm baths are generally fine once you're in a well-established pregnancy. But hot baths or hot tubs and saunas are really not good, post-embryo transfer. They can also get you dehydrated, which is not great either. All right. And then the last thing I want to mention for, during your IVF cycle is acupuncture. Now, if you haven't yet included acupuncture alongside your IVF cycle or during your IVF cycle, then now might be a good time to do so. So when we use acupuncture during an IVF cycle, we use particular protocols. And these particular protocols focus on microcirculation to the ovaries and microcirculation to the endometrial lining. And we also focus on the regulation of hormones and also helping you to de-stress and to relax. Now, most women who have acupuncture, they have what the IVF nurses call the acupuncture glow because they are so relaxed. Acupuncture is really deeply relaxing. That's what most women find. And that's probably one of the most important things during an IVF cycle is to help you to de-stress. All right, so I think that's it for now. Those are our do's and don'ts during an IVF cycle. I hope that this has been helpful for you. If it has, let me know by adding a comment below. I'd love to hear your thoughts. I'd love to hear your questions. I'll be back next week at the same time. Have a beautiful Monday. I'm signing off for now. Talk soon. Bye.